Welcome back. You're watching Bottom Line. Shifting focus now. Well, dengue crisis continues to rise in Assam and other parts of the northeast, including Manipur, with the number of infections crossing 550 mark in just 8 days. If we talk about Assam, the worst affected, of course, is Karbi Anglong with as many as 478 cases, followed by Kamrup Metro with 29 cases. If we talk about Manipur, the total number of cases so far has been 398. That's the highest. That's the highest since 2019. So definitely a spurt in cases. To discuss things like what are the symptoms, how careful should we be, when should we go for tests, we are being joined from Manipur from Imphal by Dr. Gopal Krishna Singh, Additional Director, Public Health. Welcome, sir, to Bottom Line. From Guwahati, I am being joined by Dr. Rakesh Periwal of Apollo Hospitals, and I also have with me Dr. Madhumita Priyadarshini Das, Professor of Medicine, GMCH. A very warm welcome to all of you. If I can go to Dr. Gopal Krishna Singh first. Sir, the highest cases since 2019, what could be the reason for this? Why the spurt, and why are we witnessing more cases all of a sudden?
Actually, it's not much compared to 2019. In 2019, we had 359 cases. And in 2020-21, they were a little low, maybe because we didn't detect all the cases because of COVID. And of course, 2022, the number of the cases are 398. Maybe due to that, rapid urbanization and of the people traveling the endemic areas. Otherwise, it is not much increase if you compare to 2019. We have around 40 more so far.
And the numbers are rising. Any critical serious cases that have been reported so far?
There have been 4 death cases, but of course they were associated with other diseases. So they happen to be positive with dengue infection. Even though they were positive, we can certain that it was mainly due to dengue. And we have 15 cases admitted in hospital right now, and 55 villages affected. There's no new recent cases today, and since 3 days there has been no new cases.
Okay, that's great. No new cases for 3 days in Assam. We are getting over 30 to 40 cases every day. That is concerning 550 cases in just a week's time. Dr. Madhumita Das, well, the season is changing, winter's approaching. It's pretty warm during the daytime in most parts of Assam. A lot of people are suffering from fever, flu. Fever is common at this season. When do we know that, a fever could be dengue? What are the symptoms, and when should we know when to get tested?
See, dengue is called, it's a viral illness which is transmitted by the mosquito. And the usual presentation are typically high-grade fever, body ache, there could be rashes over the body, and in severe cases, there can be bleeding. Not all cases land up with bleeding. And one thing to remember is dengue in the first attack is usually mild. When a person gets dengue for the second time, the chances of leakage and bleeding is higher. So, and also a huge chunk of patients go, with a very mild illness where they are not really detected with any, they often do not come to a higher medical center, and they often get treated locally by a pharmacist or a local medical center where it's often not diagnosed. But patients who get worse and come to maybe the Apollo Hospital or the medical college, a better center, they are usually tested. And whenever a patient comes with high fever, eye pain, retroorbital pain, as we say, headache, body ache, sometimes with those hemorrhagic patches. We do a multiple battery of tests, and in that we look for dengue. And if it's positive, we have to give supportive treatment.
So,
There is no specific drug for dengue.
so are you saying if it's if it's your first case of dengue, is if it's for the first time that you are suffering from dengue, nothing much to worry about, is it?
Usually, Rakesh will add light to it, I'm sure. Usually, the first attacks are not life threatening because dengue is life threatening only when there is hemorrhage. That's one of the major ways. And there could be many other complications, but dengue hemorrhagic fever is something we are very scared of and we are worried about. And that usually doesn't occur in the first attack of the disease, it occurs in subsequent attacks.
Dr. Periwal, would you like to add to that?
Mainly about the severe cases of disease. And as Bido said, it's the first bite which kind of sensitizes to you, except for the fact that almost 75% of patients may not have symptoms. That is one problem. The most important part is dengue, as Madam said, it's a viral illness, flu like symptoms. But if those symptoms are persisting, then we need to be concerned. By the end of the week, things should resolve. We should come back to normal recovery. And complications we generally see when it has been a few days of fever and we get those telltale signs of complications. It is generally towards the end of the 1 week that the patients become sick. So it is important that even if you have this fever viral which is not going off, it's time you should take medical attention.
Absolutely. One more question from the layman's point of view, Dr. Periwal. Is the infection, does the severity of infection also vary probably from place to place? That is something I wanted to know. For instance, when you talk about dengue in Delhi, it's pretty scary. It's taken very seriously. Dengue is not new to this part of the country. It's not new to Assam. It's not new to Manipur. We have had cases reported every time, but probably not many death cases as and when compared to, say, places like Delhi. What is the reason for that? Is there a reason, or it's
One is the detection rate. The more you detect, the statistics gets changed. So the mortality is all about how many you detected. And Delhi, we need to understand, just like Guwahati may be, very closely knit. So you can have that infection spreading fairly fast and across population. So elderly, the vulnerable ones, the most elderly ones and the very young ones who may not be able to take care, can't be supported, may not report symptoms. So that's a vulnerable population. So it all depends which population is affected. As Sir said before, comorbidities, death due to dengue. Luckily, we are not seeing people dying from dengue. Maybe we have learned how to treat them well. People come early to institutional treatment, just fluids, a very simple thing, keeping them hydrated, keeping their blood pressure controlled, having them have good urine output, and a few days of maybe in-house management, and the patients improve. So statistically, I think, Madam may add to this, we have basically have had very little mortality, and maybe this is because of better awareness and better treatment.
and Dr. Das, what is
Yes, that's very
yeah,
true.
yeah, go ahead.
Yeah, what I wanted to know is
Okay, we'll have to fix the audio there. We'll have to fix the audio there once again. Some problem with the audio. Dr. Singh, coming to you, Dr. Singh in Imphal. Well, what are the measures that have been taken by the state government this time? See, it's the dengue cases have broken a 3-year record. So, of course, it cannot be neglected. What are the steps being taken from the health department, from the Directorate of Health?
There are so many surveys going on at the district level and the state level. We have fogging the areas where the places are affected. We have done study fogging around 100 sorts, 145. Then source reduction, uh, we are finding the places where the mosquitoes are breeding, and we are doing source reduction. Then awareness campaign have done. Then we have also supplied mosquito net, netted mosquito nets, breathing, press breathing awareness, then TV, radio discussions, they are all done. So with that, and the number diagnostic approach is also very much improved, and whenever we are having symptoms of fever and other suspected thing, we are uh, promptly testing and diagnosing. I think it should in Manipur we should not worry so much because the temperature is going down. Once the temperature has gone a little more less, then the number of cases because mosquito bite will be reduced. So the number of dengue cases will be reduced.
Okay. Dr. Periwal, if we talk about Assam, 478 cases, 478 cases in Karbi Anglong alone. It's spreading. It's clearly spreading. Is there any reason if there's infection in say one particular area, chances of it spreading fast remains, and
Yeah.
that's a big threat, and that's why it's
It's
important
it's
to
a it's
control
it's
things
it's
at
a
the
threat.
very
Yeah,
outset. Yeah.
dengue has this characteristic of being hyperendemic, means localized to one area where it is there and affecting a lot of people. That also happens. So sometimes you might just have a pocket which has a lot of cases, and the other parts may be saved. It's very difficult to predict the pattern of the mosquito. You require both the mosquito and the virus together in one company, and then there is transmission from human to human or from another source to human. So it's a very complex interplay, but the Karbi Anglong numbers are really surprising. I came to know it 2 days before from your channel only. And I thought it was only Guwahati, the urban area, which was affected. But then we see the less urban areas also being affected.
Absolutely. Dr. Das, any vulnerable age group, which age group should be more careful? Is it the children, the elderly? What, according to you, is the vulnerable age group if we talk about dengue?
First of all, am I audible?
Yes, yes, yes. Go ahead. I can hear you. Yeah.
Okay, that's good. As we had, I actually missed a part of your discussion because I couldn't hear y'all. But it's like COVID or any other illness. People who have comorbidities and in the extremes of age are definitely more vulnerable. And amongst the younger population, those who have been sensitized earlier with a prior infection, which may be symptomatic or asymptomatic dengue, they are the ones who can land up with complications. So whenever we detect a person with dengue, we would like to keep them under observation, whether at home or after having got them admitted, and keep them under observation till end of a week or 10 days, as Rakesh has already mentioned, because that's the time when they actually could develop complications. Otherwise, it's nothing really much to bother about.
Absolutely. And what are the basic preventive measures we can take? Of course, there's nothing much that we can do because it's a surrounding that we live in, the area as a whole. But basic preventive measures that we can take, at least in our vicinity, in our residential complex, around the house.
At the personal level, we have to try and stop being bitten by mosquitoes. You can use repellents. You should use the mosquito net. Then, in the community, it has been shown over and over again to prevent stagnation of water and then to clean up the drains, to not leave water collected anywhere for more than 24 to 48 hours, ideally, and otherwise the basic hygiene of that area. But there's one very good piece of information that the government of India is trying to prepare a vaccine against dengue, and which is in the very preliminary stage of its development. It's in the first phase of its development. So down the line, in a couple of years from now, we hope to get vaccinated against dengue and have some additional immunity.
Dr. Periwal, the moment we talk about dengue, it also comes with a mental burden. A lot of people are worried. Okay, it's dengue infection. what will happen, and also puts a lot of stress. Any message to people, since we are dealing with cases day in and day out, even in the past, what do you have to say to people? Because it's worrying, because we hear a lot about it, especially from the metropolitan areas, metro cities, where dengue is really
True.
scary.
I think the most important point is to come in consultation with a doctor. And the second thing is evaluation, self evaluation in terms of symptoms. So, one of the significant symptoms like vomiting, inability to take, bleeding from any side, breathlessness, or distension of the abdomen or pain, then you know something is going wrong, and then getting yourself tested. What we have seen generally is a lower platelet count and elevated liver enzymes, the two most common ones. And obviously, when there is multi-organ involvement, you can have involvement of the heart, involvement of the kidneys, involvement of the brain. So all that can happen. It is very important to pick those early warning signs, because there we have a window in which we can treat you institutionally, even with supportive measures. Majority of the patients are able to come out of it.
Dr. Das, just for the benefit of our viewers, which part of the day is most vulnerable? When can you get infected by dengue mosquitoes? Which part of the day is when we should take the most precaution?
The mosquito which particularly spreads dengue is said to be a daytime biter. But the statistics say that the highest amount of transmission of infection occurs at dawn and dusk. So it's early mornings when, of course, I'm sure most of us remain protected at that time because most of the people are sleeping, and at dusk, towards the evening. But dengue also, you should remember, transmits a lot during the day. So mosquito bite anytime is dangerous. Be more careful during the day and dawn and dusk.
Be more careful during the day. Thank you so much, Dr. Madhumita Das, Dr. Periwal, and Dr. Gopal Krishna Singh. I'm sure the numbers will come in control, will fall in line. Especially, we are worried about Karbi Anglong. The numbers are really alarming, almost 500 cases. But let's hope that things get better in the days to come. However, the main point is that nothing to be worried if you are getting infected, if you're being infected for the first time. And of course, the best thing to do is, if you're in doubt, consult the doctor. That's a wrap of Bottom Line tonight.